So it's been about 4 months now, Bill, since coronavirus was widely recognized as spreading throughout the United States. We're still seeing cases increase in half of the states here. How would you assess where we are right now fighting the coronavirus?
Well, this has been a huge tragedy. The health costs, the economic costs are, so gigantic, hundreds of thousands of lives, trillions of dollars. And so we need to stop this thing. We need to stop it in the United States. We need to stop it globally. The only positive thing out of this is that the pace of innovation, the way our foundation is working with the private sector to create therapeutics and vaccines, that's moving at record speed. And that's what gives us hope that we can get the death rate down with better therapeutics. Even by the end of the year, many new therapeutics will be out. And then during 2021, we should be able to manufacture a lot of vaccines. And that vaccine, key goal is to stop the transmission, to get the immunity levels up so that you get almost no infection going on whatsoever.
Yeah, you predicted recently that this current surge in the coronavirus will drive up the death rate. How bad do you think things will get, and when do you think that would turn around?
Our peak death rate was well over 2,000 a day. The doctors have learned to use the ventilator less, to use oxygen earlier. You have remdesivir, that's an antiviral from Gilead. We're trying to get that to be reformulated so it's even easier to use. You have dexamethasone, which is an immune system modulator that a study we funded in the UK has shown. So there's the risk of death has gone down almost a factor of 2 because of these treatment understandings. But as we get into the fall and people are more indoors, if we haven't cut the infection going into that, we could get back up to that 2,000 a day.
You've said that serious mistakes were made in handling this virus, this pandemic here in the United States. What was the biggest mistake?
Well, even today, people talk about the testing number, but people should know how incompetent it is that we reimburse for a test where you don't get the results within 24 hours. You need to prioritize the tests so that you're getting the results back. You shouldn't reimburse at all for a delayed test. So the U.S. is more blind to who should be quarantining themselves than any country in the world. And it's ironic because we have more of these PCR machines, we spend more money on them, and yet because the CDC wasn't allowed to prioritize who gets tested, and the states have a hard time doing that, we are allowing the majority of tests to be essentially wasted. That delay, where they made it harder for the commercial providers to get their tests approved, they didn't let them do the testing, they didn't do community testing. Those March mistakes led to that first gigantic problem that we had. And in contrast, people like South Korea got to the commercial test providers and were able to have a very modest epidemic.